Hey guys, Dr. Stephanie here, and today we're talking about the SI joint. That's the sacroiliac joint, and you have two of them, one on each side of your lower back. It's where the sacrum, which is part of the spine, meets the pelvis, your pelvis down here, and it's a common spot for pain. A lot of people may have heard that, oh, my SI joint is out, I need it put back into place. Now, there's a lot of controversy over that, but basically your SI joint can't pop out of place. Sometimes it feels like something is out of place or something's misaligned, and that may be just because the muscles around that joint are weak. Sometimes the ligaments there get stretched out and loose. That's really common in pregnancy and even in postpartum, because if you're breastfeeding, then you still have that relaxin hormone in your body, which that's the hormone that causes the ligaments to get a little more lax. And that's to prepare you for birth. But also, if you're breastfeeding, that relaxin hormone stays in your system. So that can cause those ligaments to be stretched out and loose, but also just weakness in those muscles in your hips, in your glutes, in your lower back. That can cause those SI joints to feel like they're unstable. And they're not really. There's not a whole lot of movement at the SI joint, but it can feel like there is. And so if you have any pain there, if you have any instability, or sometimes that causes pain like sciatica, like pain shooting down the back of your leg or pain deep in your butt, if you have any of that, the treatment, it differs per person. It depends on what your symptoms and impairments are. But most commonly, working on building core strength and stability, hip strength, and working on some mobility, kind of working on the two together, will help get rid of that SI joint pain. So I'm going to go through 5 exercises today that you can do if you're feeling that pain. These kind of help to work on that stability and mobility together. And some people may need to work on a little bit more mobility and some people a little bit more stability, but these exercises kind of work on both together, and they should kind of help decrease that discomfort in that area. So for the first exercise, we're going to sit in a chair and grab a ball like this. And if you don't have a ball, that's okay. You can use a rolled up towel or a pillow. It's really just to kind of squeeze between your knees. And then we're going to use this loop resistance band. So place this band around your feet or around your ankles. Sit in the chair, and you're going to place this between your knees. This is kind of just to keep your knees apart and to keep your upper thighs in place, because sometimes if you don't squeeze something, they can just kind of move all over and then you're not working the right muscles. So in this position, you want your feet off the floor, and you just want to rotate your feet away from each other. So rotate them out and then back together, out and back together. So we're working on hip internal rotation, and that's just a movement that not a lot of people do. And if you don't have enough internal rotation, mobility, or strength, that can cause your glutes not to fire like they should. It also can cause some pelvic floor tightness and pain. You may have some pelvic pain, you may have some tailbone pain. So basically, it's important to incorporate hip internal rotation. Kind of opens up the back of the pelvis and just makes things feel a little bit better back there. So you just want to rotate these feet away from each other and then back together, nice and slow, and keeping this ball here so that the motion's just coming from our feet. And it may seem like we're just moving our lower legs, which we are, but this motion comes from the hip. So we're actually internally rotating the femurs in the hip joint. So you want to do 2 to 3 sets of 10 of this, just nice and slow. And start with a band with a low resistance, and then you can gradually increase it as you get stronger. Okay, so now we are going to go onto the floor. Let me move this chair out of the way here. Okay, now we're going to work on a mobility exercise, and this is probably an exercise you've seen me do a lot. You've probably seen other people do it a lot. It's called a cat-cow or a cat-camel. Basically, you're on your hands and knees, and you're going to arch your back up as high as you can, and then slowly move the other direction, arching it down. And then you want to keep going back and forth. You want your head to move with the movement. So looking up as high as you can, and then looking down as low as you can. Nice and slow from one direction to the other. Just back and forth like this. Up and down. And you want to do this, you can do this 20 or 30 times. You can also time it. You can do it 30 to 45 seconds, just whatever feels good. Just pausing for a second at the top and then a second at the bottom. And then from here, we're going to stay in this position. And from here, you're just going to take one leg and you're just going to go back as high as you can into extension, come back down, and then to the side, and then back down. This I like to, you can alternate sides, but I like to do all on one side and then all on the other. So we're working on some hip mobility here. We're also working on hip strength, which really you can't work on one without the other. So we're kind of working on both mobility here and strength. Just nice and slow. Go into hip extension and then hip abduction. You want to do 10 or 15 and then go to the other side, same thing. Go into hip extension and then hip abduction, and then hip extension, and then hip abduction. 10 or 15, and you can actually repeat that again if you want to. Okay, now we're going to grab a yoga block. If you don't have a yoga block, you can use a book. This is just going to elevate one of your knees. So you want to place it here under one knee. You're going to stay in this hands and knees position. Here, let me actually put on the other so you can kind of see better. So one knee's up on there, stay in this hands and knees position. And what you want to do is just lift this leg and then come back down. Lift up and back down. Lift up. And this is just kind of getting your pelvis to move with your spine, kind of move independently of your spine. Because you don't want your pelvis and your spine stuck together. You want them to move separately and work together. So this is kind of just getting some movement here. So you're just bringing that knee up, even with the other one, and then back down slowly, and up, and back down, and up, and back down. And then you'll take this and go do the same thing on the other side. So now we're lifting up, and down, up, and down. All of these exercises shouldn't be painful. They can be a little bit uncomfortable, and that's okay, especially if you're already having some SI joint pain. But the pain shouldn't increase while you're doing the exercises. And you just want to do 10 or 15 of those on each side. Okay, for the last exercise, lie on your back. And this is going to be a variation of a bridge. It's called a Cook hip lift, or it's kind of like a single leg bridge with your knee pulled to your chest. So you're going to pull your knee to your chest, keep the other foot on the ground, and just lift up off the ground and then back down. Lift up and back down. Nice and slow through this motion. You want to do about 8 to 10 and then flip and do the same thing on the other side. Just pulling that knee to your chest while you lift up into a bridge. 8 or 10, and then repeat that 2 to 3 times. So all of those exercises will work on your lumbar and hip strength and mobility, and hopefully get rid of that SI joint pain or even just your low back or hip pain as well.